Hello, everyone. Welcome to another session of Back to Basics. My name is Dr. Vivian Asamoah. I'm an integrative gastroenterologist based here in West Houston, Katy, Texas. Our practice really focuses on combining the best of both worlds, integrative and conventional medicine. And every Thursday, we bring to you an amazing specialist, someone who's just phenomenal at what they do. She's known by her patients as the Gout Queen. She's known to us, a very dear friend, as Dr. Dada, and she owns a business called Healthy Joints, Healthy Life. That is her motto. I'm going to let her introduce herself to you, but she's a rheumatologist in the greater Seattle area, but she's much more than that. She's an expert in everything related to joints, gout, and making sure her patients get the best of care with their rheumatological disorders. That's a mouthful, Dr. Dada. Dr. Dada, welcome to Back to Basics.
Dr. Asamoah, thank you so much for that very generous and kind introduction. And I'm so excited to be on your show, Back to Basics. So my name is Dr. Arinola Dada, as Dr. Asamoah just said, and I am a rheumatologist. So I help people with autoimmune diseases get their immune system back on track, and people with joint pain become pain-free. So I have a practice in the greater Seattle area called Overlake Arthritis and Osteoporosis Center, and I am just excited to be here to work with you.
Amazing, amazing. So you are in Seattle. Let me get that straight. And your practice is called
Overlake Arthritis and Osteoporosis Center.
Fantastic. Dr. Dada, there's so much we can talk about because there's so much overlap between rheumatology and GI. Yes. I would love to talk about osteoarthritis. I'd love to talk about arthritis. I'd love to talk about osteoporosis, which affects a lot of our patients. But today, I really wanted to single out something that I don't talk about very often with our patients, and which maybe a lot of people have, and that's gout. And who best to ask than the Gout Queen herself, right? Yes. So let's start with that question. What is gout?
So gout is a form of inflammation in the joint, and it really occurs because there's just too much uric acid in the system. Uric acid is a breakdown of protein, and it forms these crystals. And depending on the ability of the body to get rid of this uric acid, if it's not done properly, it ends up accumulating in the joints. The uric acid really likes the cold parts of the body, so it really doesn't like to sit around the heart, which is nice and warm. So the big toe is typically the normal, the presentation that people have with gout. So when you have these uric acid crystals in the joint, they are very painful. In fact, it's been described as, a disease of kings or rich man's disease back in the day, just because as we've been able to ingest more food, we've had more protein available. And with us having more protein available over the centuries, we've been able to build up this uric acid that we may not be able to process appropriately, and then ends up as crystals in the joint, which ends up creating this painful phenomena known as gout.
Wow, a wealth of information there. Let me break it down in my head because I'm a little slow sometimes. But what I hear you saying is that we're eating too much meat. Is that it? Are we eating too much protein?
We are eating too much animal protein.
There you go. Houston people, Texas people, Dr. Dada, if you were in Texas, you would have a gout empire. All we eat here, and I'm sure everyone on this platform will agree, all we eat here is beef. We love our meat. We love our brisket. We love our burgers. We love our beef. I mean, I haven't eaten as much beef as when I moved to Houston, Texas. So this is going to probably be very important for a lot of you guys listening. So too much animal protein, very different to eating fish and other things, right?
Yes.
Okay. And okay. So all animal protein. So this includes even game meat, venison, bison, beef, everything. Does it have something to do with the amount of fats, lean versus not lean, or is it the protein itself?
It is. I think it's more the concentration of protein. And so within the world of animal protein, some are known to be more likely to be culprits than others. Right. So in terms of in the hierarchy of the highest culprits would be the organ meat. So more the innards, right? So heart, liver, kidney, all those delicacies that we love where I come from, right? Those are kind of known triggers. The other one that's a trigger is the shellfish. So shellfish is a known trigger just based on just the concentration of the protein in the food. So those are kind of 1 and 2. And then, we can talk about meats coming in third in terms of food. And but I think it's quantity, right? Usually when you're having those rebouts, you're not taking kind of a tiny piece. It's kind of multiple ribs, and so it's the quantity of the meat. But in terms of concentration, gram for gram, then it is the shellfish, the organ meats, and then we can talk about the meats. The fish is the least likely of the proteins to trigger gout, but again, not shellfish. Shellfish kind of has its own category, if that's helpful.
Super helpful, super helpful. Now we know what the culprit foods are. Who are the culprit people, right? So my question is, if my dad had gout or my cousin had gout, will I get gout? Who's high risk? Am I high risk? Can I eat meat?
Well, so can I take a step back? When we're talking about the culprit foods, they're also drinks that are culprits, right? And so in the world of drinks, beer is a number one culprit in the world of alcohol, right? So beer is more likely to cause attacks than spirits, which is more likely to cause attacks than wine. So when people are going out, what do you want to drink? You know that water would be the best, right? And least likely to cause gout. But beer would be absolutely not on the menu if you have gout attacks, right? Because that is a known provoker. In fact, when I was in the VA working as a fellow, we had Monday morning was gout clinic because our vets would go clamming and fishing on the weekends. They would get crab and clam and wash it down with beer. And Monday morning was gout clinic.
Wow. So they'd all show up there with gout flares.
They all show up there with gout, and they know it. They're like, it's my gout. Like, how was the weekend?
So I want to make sure that our patients, our people, our tribe here on Back to Basics get that information and really are well educated in case they have to explain it to someone. You mentioned protein as a possible source, right?
Yes.
So with beer, what's the trigger? What's the trigger with alcohol in that uric acid metabolism?
It is actually in beer, right? With the yeast conversion, it is actually creating, it is protein, which is actually broken down to uric acid in beer. But there is a different pathway too, the sugar pathway.
Got you.
And the sugar pathway also, if you kind of look at the biochemical track, it also actually precipitates gout attacks. So which brings up high fructose corn syrup.
There you go. Suspected
so
that.
Sugar and protein.
Okay.
So the sugar from high fructose corn syrup and protein are those two major triggers for gout.
Phenomenal. This is such great information. I am learning a lot. Thank you. So am I going to get gout? Like, how do I know who's high risk?
Yeah. So you're right. You said family, right? If there's a family history of gout, it means that familially we have trouble either excreting gout. So, and it's not a normal kidney function. Being able to excrete uric acid is almost like a super function, right? So your kidneys can be working just fine, but they can jump these hoops, these extra hoops, right? So this is an additional kidney function that can run in families where they're not able to excrete uric acid as freely as other people. That could be one. So in terms of who gets gout, so women are less likely to get.
Gout.
Women. Yeah, we get a minute. We get
something. We get one thing.
We get a freebie. And the reason why women are not likely to get gout is in the before menopause, right? After menarche, once the menstrual period starts, well, I said uric acid accumulating in the body is why people have gout. Well, every month you have the menstrual period and you have all that blood and you get rid of uric acid with everything else. So every month uric acid levels are reduced because we're able to get rid of it with the menstrual period. In addition, estrogen actually increases the ability to excrete uric acid out. So most women are not going to get gout until after menopause, when the estrogen is down and the periods are gone. Being on certain medications like, water pills, well, it gets rid of sodium and gets rid of water, but it keeps uric acid. So things like the hydrochlorothiazide. So people are on that medicine, and online you find people saying, I'm going to stop it. I found that it causes, you got to work, because at the same time, your blood pressure needs to be controlled. So it's kind of working hand in hand with your doctor to say, hey, I have gout. I'm on this water pill. What can we adjust? What are the options? But not just saying, aha, I'm going to stop it. I'm done. Just working with your doctor, letting them know what else is going on, I think would be helpful to patients.
Wonderful. So we talked about genetics, a family history. We talked about the protective nature of estrogen and being female and maybe seeing a higher risk when estrogen goes down and we're postmenopausal. We talked about medications, notably water pills. Any other risk factors?
Oh, definitely. So people who have kidney disease, as you can imagine, right? Yeah. So not all people with gout have kidney disease, but most people whose kidneys are not working well at all are more likely to get gout.
Okay.
Right? And people who have lost a lot of weight. Right? Because muscle is protein. So if you lose a lot of weight dramatically, you're more likely to get a gout attack, which is good. The overall effect is good. The endpoint is good. Just like the journey there may be laden with gout attacks. I had a patient who had lost significant amount of weight. When he came in, he was 200 pounds heavier than he should be, and he'd done the whole 30-20 20-20 program and everything, and so he lost weight. And so when he met me, he had a multiple gout attacks, we put in a medication, and he lost so much weight that his uric acid level self-corrected, and we eventually got him off all those medications, and he was gout free because he was almost a new person, right?
Excellent. Okay, so excessive weight loss. Anything else that would increase someone's risk of gout or gout attacks?
Unfortunately, there may be some medical conditions, right, that may predispose one to getting gout. So, for instance, some cancers, right? Patients with some cancers, and they're getting the medication to treat the cancers, when it's being broken down, can cause gout. Some medications, right? Even like medications like cyclosporine. It's a medication that's used for transplant patients. And so it was very common when I was a fellow at the University of Washington that we would go to the organ transplant unit to treat patients with gout attack, because a lot of the medications they used were more likely to cause the uric acid to be retained and cause gout attacks. So medications may be, family history may be, not being a woman,
being the other kind.
Being the other kind, and being on even just some blood pressure medications.
Okay, that's a lot. That's a lot of potential people. Absolutely. So, is there a genetic test that you can do to see if your uric acid metabolic pathway is on point, whether you'll be able to excrete uric acid properly or not? Does that exist? And do you test?
No, we don't have a genetic test. That's hopefully will be coming in the future, right? To see if you're under excreta or over, or you're able to, or you're retaining too much. There hopefully in future would be that. The genetic tests that we do are really right now just to see if you can tolerate one medication over the other. So those are the genetic tests that we typically run for people with gout. The number of medication options and the genetic tests help us to figure out who is more likely to tolerate one medication over the other.
Excellent. Okay, so Doc, we'll get into medications because I know you do quite a bit of clinical research. You are really trying to figure out the best possible treatments for your patients. Let's touch on what you tell patients, right? So someone comes to you with a gout attack. It may be their first one. As we love everything that's holistic and natural and back to basics and natural gut relief, what are the top 3 recommendations that you would give to this person in terms of what they can do to prevent future attacks?
Yeah. So there are 5 things that I typically tell my patients when they come in on day 1. The most important thing is keeping hydrated, right? So when you're hydrated, your urine, you can see the urine is clear. The more hydration you have, the more likely you're able to get that uric acid out of your system naturally. So that's 1. 2, we talk about diet. And when we're talking about diet, we're usually talking about, things like avoid shellfish. I tell them beer is a no-no. Just forget about it. It doesn't exist.
Cut it out.
Cut it out, right? If you must drink, I'm going to say wine over spirits because we're not having a beer conversation, right? Avoiding high fructose corn syrup. Right? Look at anytime there's something in a box, you would be surprised how many things have high fructose corn syrup in there. So if you're going to eat anything that's not natural, which you should be trying to eat things that are more organic anyway, but I know they're expensive for people. But looking at the box and really kind of going through the ingredients is important. A general rule, people are like, oh, so what will I eat? Because when I looked on the list, it has asparagus, it has this, it has that. The big picture is that we can process proteins from plants better than we can from animals. So if you went and you ate a bowl full of asparagus, that is not what's triggering your gout. Is that side, the meat that you had on the side?
The lamb chops.
Yeah, the lamb chops.
My favorite.
It's not the asparagus, right?
Yeah.
So you can go wild on so that we don't feel bereft, right? Plant protein, your body can process that with such ease. Animal protein is where your body struggles, right? Because if you think about it, historically, centuries, we didn't have as much access to plant protein. So we did not evolve in a way that could process that volume of animal protein.
Yeah.
We're used to processing plant protein, right?
Got it.
So and then if you have a family history, right? If you have a family history of gout, you know that you're more prone to gout. And so being in touch with either your primary care doctor or your rheumatologist, because one of the things that can happen with people with gout is they're like, I had gout once like 5 years ago, and then I had it like a year ago, and then I had the first attack now. So they go and they treat the symptoms, but they're not looking at the underlying condition. The fact that the uric acid can accumulate quietly. Right? That you can still have lumps, and then one day you have an ulcer on your toe, and you're like, I don't know what this is, and your podiatrist finds the lump, takes it out, and says, this is gout. You're like, how did that happen? I only had 3 attacks.
Right.
But it silently can continue to accumulate, especially when you don't watch your diet, increase hydration, and pay attention to avoiding high fructose corn syrup and alcohol.
Wow.
So those are the things that I tell my patients so that we can all work together towards getting them gout-free and pain-free.
That's fantastic. So some wonderful tips that Dr. Dada is sharing. She said hydration. By hydration, she means water, guys, right? Not soda. She said, avoid the high fructose corn syrup. Look on the labels. High fructose corn syrup is in soda and so much more. We don't like that in GI either because of what it does to the liver, right? She says, go plant-based. Don't be scared about plants. We process that much better. We don't, our process of that does not prevent us from causing issues down the road. Even we process those much better and we don't have gout attacks with that. She said, quit beer altogether. Quit beer altogether. And she says, if you have a family history, take note, talk to your family members, keep track of what's going on, because this could be a silent accumulation of uric acid. And you may have just had 1 or 2 attacks and then end up with tophi, is it called tophi?
Oh, you're brilliant. Yeah, exactly.
Like tophi in your toes.
Oh, and it kind of looks like tofu too.
It looks like tofu. So some wonderful tips here. So Doc, for our patients listening, Dr. Dada, when they go now everyone's going to be like, do I have high uric acid? And how often does your doctor check it? How often should your doctor be checking? Should they only be checking if they suspect an attack? Your uric acid in terms of blood uric acid?
That's an interesting question, right? Because there is no action to take if your blood uric acid level, there's no action to take with medication. Okay. If your blood uric acid level is high and you don't have gout symptoms, so you don't have kidney stones, you don't have joint gout attacks, you don't have lumps of TOFA in your ears and stuff, right? So if there is nothing to treat that high uric acid level has not manifested in any way, I think that yes, there's no indication for medication, but there's an indication for a conversation. Because uric acid is known to be pro-inflammatory and also known as a cardiovascular risk factor.
Wow.
So your doctor may not necessarily say, hey, we need to lower it with medication, but I think it's a beginning of a conversation about, hey, you have this thing and it's a risk factor for cardiovascular disease. Let's talk about how you can lower it naturally, which is all the things that we talked about.
Right.
So minimizing your risk from
minimizing it. So it's basically a high uric acid may be a sign that, hey, knock, knock, something may be brewing down.
Yes.
This is the time where we like to talk about prevention. Right?
Exactly.
We've identified some things. Just because you don't have the disease now and you don't need prescription medication, how do we prevent? I think is what I hear you saying, Dr. Dada. How do we stop this? And by a lot of the recommendations you've made, your 5 things that you always tell patients, it's just lifestyle and nutrition stuff that we should all be doing on a day-to-day basis anyway, right?
Yes.
Okay.
Exactly.
Okay. Now let's talk about medications, because as a rheumatologist specialist, this is your forte. This is what you treat. As the gout queen, let us know what treatment strategies when someone is suffering and they have TOFA. If you tell them stop drinking beer, it's not going to help their pain. So what prescriptions do you recommend? What medications?
Yeah. So I think the gout, the treatment for gout is dependent on the presentation. So most of the people that come to see me are coming because they're in pain, and they've been in pain for a minute and they're not happy about this. So they're like in the rheumatologist's office knocking, how do we get rid of the pain? So getting rid of the pain, anti-inflammatory medications like ibuprofen, Aleve and stuff are things that people have already used before they see me. And in fact, I don't recommend them, because by the time they've seen me, they've taken so much ibuprofen and Aleve and stuff that they've started to damage their kidneys.
And their stomach. And their stomach.
Well, yes. Yeah. So I saw you sit up. You're like, those best. So anti-inflammatory medications from my standpoint is a no-no, because I think we can do better. And so by the time they've seen me, a lot of patients have identified they can take Aleve, ibuprofen. They just take a bunch of Aleve. And in fact, the other day I saw a patient who was perfectly fine. He had gout and his kidneys were abnormal. I was like, why are your kidneys abnormal? You're a 40-year-old man. Why are you? And he said, well, I just pop Aleve. And I was like, okay, stop popping Aleve. Okay. So I don't do that. So back to what I do, right? So steroids are things that we use in moderation and for a short period of time. We hit it hard and we get rid of the inflammation. So this is when a patient is presenting acutely with pain. The other thing that we do, that patients enjoy the relief, but not the procedure, we do cortisone injections into the joints.
Okay.
And that kind of provides immediate relief. The other medications, we use a medication called colchicine, which what that does is that it reduces the ability of the white blood cells to come in there and cause all this pain and inflammation. So it's an anti-inflammatory medication in some way without the side effects of ibuprofen and Aleve. So those are typically how we treat the acute attack. You're coming in with pain, we use steroids, we do injections, we use a medication called colchicine, and we avoid the non-steroidal ibuprofen, Aleve, etc. So that's day one. We get rid of the pain. When you are pain-free and you're able to kind of have the conversation, then we talk about the 5 things that we want to do: nutrition, hydration, avoiding high fructose corn syrup, and beer is no longer on the table for you. Okay. So we have that conversation. And then depending on how many attacks you've had, we also look at things like x-rays, because we want to see if there's any damage. Like we said, gout can be accumulating silently.
Yeah.
So for a person who this is their first ever attack, we talk about nutrition and we're like, just check in and see us and let's see how things go. And I've done x-rays. There's something called a dual energy CT scan, which is a special scan of the legs just to see if there's been any silent accumulation of uric acid or lumps of TOFI that kind of look like tofu in the skin. So it could be under the skin, it can be in the joints, it can be in the muscles or in the tendon. So we scan for that. If that is clean, you are good. Talk about diet, have you follow up when you need us. If on the other hand, we're finding there's damage to the joints, there's TOFI everywhere, it's a different conversation. The first thing is, how do we stop your body from making any more uric acid?
Mm-hmm.
We use medications like allopurinol and Uloric because we want to stop you. Just put the brakes, shut the
Mm-hmm.
gates, stop
Mm-hmm.
making it more. And then depending on how much uric acid you have in the body, there are
Mm-hmm.
different medications, something called Cristexa, which melts away the tophi. So
Oh,
really depends on the severity. We're able to personalize the treatment for each
okay.
person and help them understand kind of where we're going, what our end result is. And the end result is stop making any more uric acid, find ways in which we can lower uric acid, without medication, because we kind of need the patient to work hand in hand with the doctors, right?
Right.
Everything that you can do reduces the dose and the frequency of medication that you need to become gout free.
And that's always your goal, it sounds like, Dr. Dada. You're getting patients to be able to have healthy joints
Yeah,
and become gout free
gout
long
free.
term down the road, just to avoid all the complications. So, wealth of information, Dr. Dada. This is fantastic. Now, one last question, because I have this wonderful expert and I'm learning so much. Do patients ever come to you and say, talk about grandma remedies? Are there any that work? Will patients come to you and say, people watching so many things on TikTok and here and there, this whole uric acid metabolism sounds quite complex, right? But do patients ever try anything natural? And do you know of any natural supplements that help reduce the risk of gout flares?
Yeah. So cherries, right? So cherries have been shown. It has anthocyanins, which actually have been shown to prevent gout by increasing uric acid excretion. Right, so it allows you to pee out more of your uric acid.
Mm-hmm.
So cherries, cherry juice, but remember, watch for the high fructose corn syrup in some of that cherry juice,
Yep.
right? So cherries, I think, is the number one studied. The other thing is vitamin C.
Mm-hmm.
Has also been studied because it acidifies urine and allows increased excretion. So that's, I think, where we have most of our data from on. That's, there's a lot of stuff out there.
Yeah.
But the stuff that we actually have some science and data to support it. And of course, hydration, right?
Okay.
So I think those are kind of the three things I think that we have data and scientific data that supports promoting that and encouraging patients to do that.
Fantastic. Oh, wow. This has been a wealth of information. And for those of you out there suffering from gout, please, or know somebody who's suffering from gout, please share this video because it could be extremely beneficial. Dr. Dada has mentioned lots of therapeutic options. So there may be something that maybe your doctor has not even proposed, but know that it is now available. There have been a lot of recent discoveries and medication in terms of treating gout, and definitely connect with your doctor to get more information. I did not know that having, we were talking before we got on, how does this impact your gut patients, and a wealth of information, so much information about how diet and even using food as medicine to reverse or slow down certain disease processes like gout. See, it works. It absolutely works. So this shows how important this is. Dr. Dada, where can patients find you?
Thank you. So if you are in the greater Seattle area, you can find us in the Blvd area at overlakearthritis.com. Look us up on our website. You can follow me at Arinola Dada, MD, on Facebook, also on Healthy Joints, Healthy Life. We also have a YouTube channel, Healthy Joints, Healthy Lifestyle with Dr. Dada. We have a podcast, Healthy Joints, Healthy Life with Dr. Dada. So, love to continue to provide you with information that helps you to a healthier version of yourself.
Fantastic. And guys, she's not just the gout queen, she's an expert rheumatologist. So anything related to osteoporosis, she is often the person I go to for counsel, arthritis, inflammatory arthritis, IBD related arthritis. Please check out her podcast and her YouTube page, Healthy Joints, Healthy Life. Thank you so much, Dr. Dada, for coming on.
Thank you so much for
Thank
having
you.
me. I had a wonderful time.
I'm so glad.
Show. I'm so glad that you provide this as a forum for your patients and just kind of, helping people through the functional medicine and integrative part of medicine so that we can kind of find ways to have natural gut relief too while we're at it.
It's all about natural gut relief. Thank you, Tri, for being with us again. My name again is Dr. Vivian Asamoah. I'm an integrative GI specialist based in West Houston, Katy, Texas. Our goal for each and every one of our patients is to combine the best of both worlds. We deliver the best of conventional and holistic integrative medicine for the best patient outcomes in terms of your gut health. If you found this video interesting, please continue to follow me on YouTube to learn amazing information and learn from amazing guests, all things related to natural gut relief and gut health. Have a wonderful day, guys.
Bye, everybody.
Bye-bye.